The shoulder is made up of several joints working together. That's why shoulder pain can be so tricky. It could be a simple strain, or it could mean something deeper is going on. But even if you haven't fully dislocated and it just feels like it might come out with certain movements, that's still something we take really seriously. If instability is ignored, it can lead to further injury and long-term damage. So if you're feeling shifting, clicking, or a sense of looseness, you don't want to ignore that. Shoulder pain is one of the most common complaints I hear in my office. But here's the thing, not all shoulder pain is harmless. Maybe you've chalked it up to sleeping funny, working out too hard, or too much time at your desk. And sometimes that's all it is. But in other cases, shoulder pain can be a sign that something more serious is going on. Today, I'm going to walk you through the red flags, the signs that tell you it's time to stop pushing through that pain and get evaluated by a shoulder specialist. So the shoulder is a complex joint. Before we dive into what can go wrong, let's quickly review what makes the shoulder so unique and so vulnerable. The shoulder is made up of several joints working together. The glenohumeral joint, or the GH joint, that's your classic ball and socket joint. The acromioclavicular joint, or AC joint, where your collarbone meets the top of your shoulder. The sternoclavicular joint, or SC joint, where your collarbone meets your breastbone. Then you add to that tendons, ligaments, muscles, and bursa. It's an incredibly mobile joint. It's the only free hanging joint. And that mobility comes at the cost of stability. That's why shoulder pain can be so tricky. It could be a simple strain, or it could mean something deeper is going on. Let's start with the first major red flag, shoulder joint instability. If your shoulder feels like it's popping out of place, sliding around, or just doesn't feel stable like it's going to pop out, that's a reason to get it checked out. If you've actually dislocated your shoulder, that's an emergency and you need to head straight to the emergency room. But even if you haven't fully dislocated and it just feels like it might come out with certain movements, that's still something we take really seriously. It could involve any of the shoulder joints I mentioned before, the GH, AC, or SC joints. When you see an orthopedic specialist, we'll test the ligament integrity and examine the shoulder capsule to see what's going on structurally. If instability is ignored, it can lead to further injury and long-term damage. So if you're feeling shifting, clicking, or a sense of looseness, you don't want to ignore that. Red flag number 2, pain and weakness in specific movements. The next sign that your shoulder pain may be serious is pain or weakness during overhead or behind the back movements. This might look like pain while reaching up to put dishes away, struggling with overhead presses at the gym, reaching behind your back for your wallet, or twisting your hand to give your kid a snack in the back seat of the car. If you feel sharp pain or weakness during these motions, especially if it's getting worse over time, it's time to get evaluated. We want to rule out rotator cuff tears, impingement, possibly nerve involvement. It's not just about pain, but loss of strength or coordination during these movements could point to something more serious going on inside the joint or the tendon, which, as I mentioned before, could be a tear or impingement. Red flag number 3, loss of motion or stiffness. Another big warning sign, progressive stiffness when you've noticed you're slowly losing motion in your shoulder. Maybe it's subtle at first, you wake up and feel a little stiff. And then after over a few weeks, your range of motion keeps decreasing, and now it's painful just to raise your arm to 90 degrees. That's a common sign of frozen shoulder, also called adhesive capsulitis. This condition doesn't just limit your function, it can be debilitating if it's left untreated. The sooner we evaluate and start treatment, usually physical therapy, the better your chances are of a recovery from that frozen shoulder. Red flag number 4, shoulder pain that radiates down the arm. Here's one that surprises a lot of people. Shoulder pain that radiates into your arm, neck, or even your upper back. This can sometimes be confused with heart or nerve-related issues. While not all radiating pain is dangerous, it's definitely something you want to pay attention to, especially if it's accompanied by tingling or numbness, burning pain down your arm, weakness in your hand or grip. In some cases, this kind of pain is caused by nerve compression in the neck, not even in the shoulder itself. We call this cervical radiculopathy, and it can mimic rotator cuff symptoms. I can't tell you how many patients I've seen that thought they had a shoulder issue, but they really had a neck issue, and vice versa. If your shoulder pain isn't staying put and seems to travel, it's worth getting a thorough evaluation, including a look at your cervical spine. Red flag number 5, pain after a fall or direct trauma. This one's pretty straightforward. If you've fallen, you've had a direct blow to your shoulder or landed awkwardly and now you're having pain, you don't want to wait on this one. Even if it doesn't feel like it's that bad, a fall can cause a clavicular fracture, an AC joint separation, a dislocation, or some things that are more subtle like a labral or rotator cuff tear. These injuries might not always swell dramatically or bruise right away, but they can cause long-term instability or arthritis if they're left untreated. Also, rotator cuff tears can get bigger. If the pain came on right after the trauma and you're having trouble lifting your arms, sleeping, or using the joint normally, you want to come in for an evaluation sooner rather than later. So what to expect during a shoulder evaluation? So let's say you've got one of these red flags and decide to get it checked out. What will happen next? The first step is a detailed physical exam and an x-ray. X-rays are the best first-line imaging tool we have. They show us bone alignment, joint spacing, especially in the glenohumeral and acromioclavicular joints, bone spurs, sign of arthritis or degeneration, and we can also evaluate the subacromial space, which is a common site of impingement and rotator cuff problems. We'll order an MRI if needed to look at soft tissues like the rotator cuff, bursa, and any inflammation around the joint. Here are some of the more serious diagnoses we may be looking for: muscle or ligament tears, frozen shoulder, impingement syndrome, arthritis or cartilage wear, dislocation or instability, and fractures or bony lesions. Once we have a clear diagnosis, we can build a personalized treatment plan, which may include physical therapy, anti-inflammatory medications, cortisone injections, or regenerative therapies like PRP. And in some cases, you may need surgery. Your shoulder shouldn't hurt every day. It shouldn't wake you up at night. You shouldn't feel like it's giving out, grinding, or freezing up. These are not normal signs of aging or just overdoing it. These are signals from your body telling you that something more serious may be happening. The earlier we can catch it, the more we can do to fix it without surgery in a lot of cases. I'm going to dive deeper in other podcast episodes on youth sports and shoulder injuries, as well as menopause hormones and shoulder injuries as well. But the important thing to recognize is that we can treat this with physical therapy and injections. But if we wait for too long when it comes to a shoulder injury, it may require something more invasive like surgery. Frozen shoulder is really tough to deal with. Oftentimes it's so insidious, patients don't realize that they have a frozen shoulder, and sometimes they just wake up and they cannot move their shoulder. The problem also with frozen shoulder is that we aren't able to cure this really quickly. We cannot treat it within 1 to 3 months. It often takes 6 months to a year before we can get you back to full range of motion. Surgery is probably one of the worst things for frozen shoulder because immediately after surgery, your capsule for your shoulder starts to scar down or freeze up again. So we really want to take our time with frozen shoulder and use a mix of physical therapy, home-directed exercises, and sometimes injections. Impingement syndrome and partial rotator cuff tears also can create a problem if not identified early. That impingement or partial rotator cuff tear can become full thickness rotator cuff tears. And when you have a full thickness rotator cuff tear, we need to do surgery on that, especially if it's not in a degenerated joint. When you have a partial rotator cuff tear or an impingement, there are a lot of things we can do before we have to consider surgery. That's why it's better to get evaluated earlier than later. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.